have Dr. Terry Engelken with us. He is from the ISU Vet School and is a good resource for us on our beef extension team for kind of all things feedlot from that standpoint in terms of veterinarian expertise. So I'm sure he'll have a couple jabs for us nutritionists here today. Wouldn't expect anything less, but he is a great resource and a friend of our beef extension team. So his topic today is focused on necropsies and the value that they can bring to our feedlot settings. So Dr. Engelken, thanks for joining us, and I'll let you take it away.
Okay, thanks, Erica. Yeah, there is a couple nutritional related slides in here. I just was going to keep them out, but I just couldn't help myself. So what we'll spend here next 30 minutes or so is talking about how do we use necropsies, why they're important, what information can we glean from them. I realize that nobody wants to spend additional money on a dead animal. But I think there's some reasons to do that, and we'll talk about those. And I think we can get some pretty valuable information from those as we, as we evaluate the health performance of the cattle. So why do we do it? What we're really trying to do is, there's kind of two reasons to do a necropsy. And one is a mentor of mine, Dr. D. Griffin, who's retired out of the Nebraska system, always used to say that each necropsy is like a Christmas present because you never know what you're going to get into or what you're going to find. And that's not necessarily true in most feed yards, because you've got a record system and you're tracking why you're treating these animals, and so you have kind of a history as to why they may have died. But I think what may be more important is to evaluate the type of lesions that we have versus the management area of the feed yard that might be responsible for that or that could contribute to that. And so one of the and those management areas could be, how the cattle were purchased, where, how they were procured, how are they handled, the treatment protocols, the receiving protocols, from the veterinary side, the nutritional management, all the way from ingredients to mixing to feed delivery. Again, we're trying to figure out, from a systems approach, what went wrong, and is there some consistent things that we're finding in these. So some of the things we want to look at is, does the cause of death, what we find on necropsy, match up well with the reason the calf was treated? I mean, we'd expect calves that are being treated from pneumonia or for pneumonia and died from pneumonia to have lung lesions. And are we truly seeing that? What different lesions can be found in the affected organ? We can see different types of pneumonia in the lung, and we'll talk some about those that have different causes and have different treatments. How old are these lesions? I think that's an important point to consider with how long you've owned the cattle in your feed yard versus how old these lesions are. We'll talk about that. How extensive is it? What organ is involved? How much of the organ? Again, gives us some insight as to the pathogen load and what's going on with that pen of cattle. And then finally, do we need to change something based on what we're seeing on these necropsies from a treatment standpoint or receiving protocol, vaccination strategies? Is there something we need to do feed wise? Again, getting back to those management areas. So that's really why we, I think, where the value of necropsies resides. And so at the very least, we would like to get all pen deads or cattle that die in the pen that haven't been treated, or also any unknown deads where, you're treating some cattle and maybe you're treating some calves and you're not sure why you're just not comfortable with your diagnosis. And those are some calves we need to get into just to make sure that, again, getting back here is our cause of death matching up for our reason, that we pulled them and treated them. And then finally, I really would like to get into all deads that occur less than 30 days on feed, because again, that gives us an opportunity to get ahead of outbreaks in the future. It also gives us an opportunity to evaluate oftentimes how well the cattle were handled before they got to your feed yard in terms of what we're seeing there. So I'd love to see every calf necropsy, but Again, I live in the rural world, and so sometimes we have to pick and choose as to the ones we do. And these are some of the reasons why we do them. And this is some of the reasons that will fill into what animals we really want to get done. Okay, so with that, I'm going to just kind of go through some slides. We were talking with Erica to start with. Some of these are, they're necropsy slides, so we'll see what YouTube has to say about putting them up on there. And hopefully you're not eating your dinner when you're looking at some of these, but I guess that's the beauty of a WebEx meeting. Nobody will ever know. So starting with the respiratory system, here's our larynx. Okay, we just split it right down the middle, and this would be what we would see with calf diphtheria, or those calves that you can hear breathing from 20 yards away before you get there. Again, there could be some IBR associated with this. There could be some bacteria associated with this, or a combination thereof. But again, typically it results from some type of insult to this mucosal lining here in the voice box or pharynx, if you will. And there are different lesions that will, or different organisms and different causes of this type of loud breathing in cattle. Another one we will hear from, or you may have heard about, is tracheal edema. We're down here lower in the trachea. This is going down the windpipe toward the lungs. We may see some swelling and some fluid accumulation and really narrow this. So again, the necropsy is going to be able to tell you what type of condition you're dealing with. And again, different conditions would give you a different intervention strategy. Here's our old friend, and I really shouldn't say old friend, but our old red nose virus, or IBR. We don't see a lot of this anymore because our vaccines tend to be really pretty effective. I don't know about your yards or other veterinarians. If I see this in a feed yard, I typically don't see it early on. I think I tend to see more of these maybe 60 days, 70 days or later on feed. When we've had some IBR floating around, but again, our vaccines are very effective. And so here's the calf's windpipe or trachea, and we've got just a big glob of tissue and fibrin where the lining of this trachea has just peeled off. And we got this fiery red inflammation. And again, these calves will run a tremendous fever. We've got some swelling in the wall of the trachea. And so this can be a really bad trigger for respiratory disease or BRD in our feedlot pens. But again, vaccines are very effective, both intranasal and injectable. And we don't see near as much, or at least I don't feel like I see near as much of this as what I used to. But again, this whole area has just used to be attached to the wall of the trachea, and it's just peeled off due to the virus. BVD, we talk a lot about BVD. And again, there's some kind of subtle lesions. It's hard. You really can't look at a calf and tell if he's got BVD. But this is the calf's esophagus, or where the food goes down, and you see these little ulcerations in these where this is a calf that's a BVD carrier, and one of the problems with BVD from a feed yard perspective is the carrier state starts in the cow-calf herd. And so when we see these at the feed yard, there's not a whole lot we're going to do about it. Hopefully our main control is to vaccinate for the disease, as part of our receiving protocols. But again, BVD can fool us in a lot of cases. It can give us diarrhea in calves. It can cause respiratory disease. It can cause non-eaters because, again, we can see some of these lesions. Calves that have these types of lesions in their mouth and in their esophagus, they're not going to want to eat. So it's, again, really one disease where necropsy here in the abomasum as well, or the fourth stomach, if you will, can really give us some good indications as to what's going on with these calves, especially in problem pens where we seem to have a really poor response to treatment. Okay, so now we get down in the lung and we deal with the pneumonias, which is by far and away our most, costs us the most money, respiratory disease in our feed yards. Nutritionists always remind me of that every now and then when I start on their end of the thing. But so here's the calf's head, just to orient you. Up to your left on the screen, there's a ear tag, the calf's head. Front leg is folded back, and we're looking at the lungs and the heart down here in the bottom. This would be a very early pneumonia or quick pneumonia. We've got some discoloration here and a little bit of color change here. So again, with you'll hear it referred to as bronchopneumonia, but most of the time we just lump it into pneumonias where most of the problem is in the downward front part of the lung, where we typically see it. And this would have been fairly acute or fairly quick by the time this calf started showing signs and when he died. And we can see some of these that were fine in the pen yesterday, and we find them dead the next morning. That's how quick they can occur. But again, that just looking at this allows us to age this lesion and kind of decide and work with our pen walkers in terms of, okay, was this a miss, or what do we know about this calf previously? So that'd be an early stage pneumonia there. Then we get into a little later, or you'll hear this referred to as fibrinous pneumonia as well. And again, this yellow coloration is fibrin, or basically what cattle really like to do and what they're really good at is trying to wall off infections. And so they'll put down this fibrin to try to get control of the infection, and doesn't work that well, or doesn't seem to work real well in the lung. But it's just part of their normal inflammatory process. And so this calf is a little longer into his disease process, probably several days. So again, if this calf died in the pen with this type of lesions, we know he was probably a miss, and that we need to go back into that pen and look harder and make sure that we're finding those sick cattle in a timely fashion. A little farther advanced along, and you may have seen these as well, but we start to get these spider web adhesions. And again, so now we're probably 4, 5, 6, 7 days out beyond the initial insult, to where again, where this calf is fighting the infection by putting down fibrin over the top of the lung, and now we've got these really the infection has gotten away from us, and now we've actually got these adhesions attached to the lung, to the rib cage. As you can imagine, these lesions are very painful. We tend to see them more in chronic calves. So now we're getting out close to 10 days, 2 weeks post-infection, or typically, this is typically a calf that has had multiple treatments, and we're just trying to keep him alive and move him to the chronic pen. But again, a very different look than that early picture I first showed you. And then we get into the really chronic ones, and these are calves that are you have these really strong adhesions to where when I pull that rib back, I'm actually going to probably tear a piece of lung with it. That's how strong these adhesions are. And again, you can see the fibrin here, the discoloration over the top of the lung. Here's a calf that's been sick at least 2 weeks. And where that becomes important is that if we're having calves die within the first week, say, use that as an example, within the first week of after they arrive at your feed yard, and we're opening the chest and we're seeing these big strong adhesions like this, but we know that those calves were sick prior to you getting them. And everybody makes mistakes, and everybody when they're sending you cattle, they things will slip through. And these calves may look good getting on the truck, but when you have this type of adhesions, the least amount of stressors, such as a truck ride or tough weather, will make these calves fall out. And so if we're starting to see, lesions like this in cattle that have been at your operation for less than a week, it's probably time to have, if there's multiple ones, there's probably a time to have a conversation with your order buyer or whoever sent you the cattle. And that's what I mean, using necropsy lesions to evaluate acquisition of the cattle. How old are these lesions versus how soon or how long the cattle have been at your feed yard. Another common example here is our old friend, Mycoplasma. Again, with mycoplasma, we have these little, some people refer to these as shotgun abscesses because they have these little round abscesses just on top of each other, and it looks like somebody shot the lung with an abscess shell. These are typically, at least in my hands, tend to be cattle that haven't really responded well, chronic type cattle, um, things that, cattle that probably treated multiple times and didn't respond very well. And again, these inevitably wind up in a chronic pen or out in a chronic pasture somewhere, just kind of give them time to maybe recover and realize them out if that's possible. One of the things we do see with mycoplasma is we will see it hop in the bloodstream and settle out in the joints. And so here's a calf with a synovitis or an infection of the tendons running up the leg, and that's what gives us. And you've probably seen those, many of you, where you get these calves that have respiratory disease, and then 2 or 3 or 4 weeks later, after the respiratory outbreak, you start seeing calves showing up with swollen joints and limping. Front knees and hocks and shoulders, elbows. This is kind of what you're looking at. And again, you can see in this particular calf 221, this calf had been treated 3 times already, and obviously then didn't respond. And so we wind up with, again, mycoplasma lesions in the lung like this, and then we'll see those swollen joints and tendon sheaths being inflamed, at a later time. Shifting gears a little bit, we'll have a form of pneumonia called AIP, or atypical interstitial pneumonia, and basically it's where you'll hear it referred to also as acute interstitial pneumonia as well. More from the feedlot standpoint, we would tend to use acute, or they come on very quickly. And rather than some of the previous slides I showed you where the lung was collapsed, these lungs are full of air. And it's a very different type of pneumonia than what I showed you previously with those adhesions and the bacterial component associated with that. When we get to AIP, you open up the chest and the lungs don't collapse. Here's another picture of it, of what they look like grossly. And you see this kind of checkerboard appearance, and the lungs are thick and spongy and full of trapped air. So it's a very different lesion than that acute pneumonia that I showed you early on here. Okay, so where that lung is collapsed and it's fallen in, these are full of air. When you cut through it, it's almost like cutting through bubble wrap or styrofoam. It may even squeak a little bit as you cut through. And really what we've got then is we've got disruption of the cells that line these, and you can see the little airways here, the little lines in there. And we get air trapped in there, and we get serum extruded into the lung from that. And so, a lot of times these calves, it's literally they almost drown. Clinically, you'll see these calves. If you look at risk factors, we tend to see it more in heifers. We tend to see it in pens where we have digestive upsets, in pens where we have some bloats or acidosis early on. We tend to see it in cattle that have been on feed. Some of the literature will say over 45 days. I think it's probably more common, at least in my hands here, to see it in cattle that have been on feed at least 90 or 100 days. So cattle that have some pretty significant days on feed under their belt. And the other thing, and it tends to be during the summer and into early fall. And so some folks will refer to this as dust pneumonia because that's when we typically see it, is during a dry summertime, but we're not really sure what causes it, although it would appear that there is some connection between what's going on in the gut and what's going on in the lung. And so these calves will present just in severe distress, open mouth breathing, tongue hanging out. When they exhale, they grunt because they're trying to push this air out and they just can't get it out of there. Treatment response is not very good. We'll try some, if we can. We actually would. It's almost as good to use emergency slaughter on these things because the case fatality rate is so high, and so be careful when you're handling these. And if you've seen them, you know that because they're really respiratory compromised, and if they've got to walk far to get to the treatment pen or the hospital, they're liable to fall over dead just due to the fact that they're not getting any air. So it's a really frustrating disease. It's yeah, I'm sitting, I don't know if you can see that. I'm sitting here shaking my head just thinking about it. We have a lot of them, a high percentage of these will die. Um, but when you look at preventative things, is, control dust, make sure your feed is mixed well. We think that MGA may play a role in it, and it's probably due to calves going along with heifers. It may be due to the fact that not all heifers eat their MGA on a daily basis. So we may have some cycling in the pen. But again, this is a very, very different pneumonia than what we talk about with our, bronchopneumonia. When you look at these AIPs in cross section, you can see that all this shiny stuff is filling up the airways. It's kind of a serum fluid type of mixture, and that's why the calf is having trouble breathing because they can't move any air, and it's trapped in these. You can kind of see these bubbles in here. The air's trapped in there, and they just can't move it. So again, a very different type of pneumonia than what we typically would see with bronchopneumonia or what I showed you in the earlier slides. Okay, just some miscellaneous heart lesions. We see some of these. This is a normal shaped heart. It's funny. I was going back through my slides, and I evidently never take picture of the normal stuff because I had to go onto Google and find a normal shaped bovine heart. I'll try to remember to take one of those. But again, a normal heart has a kind of a V-shaped appearance to it, and comes down here to the ventricle at the point, and just kind of has this triangular type of shape to it. When we get into respiratory cases that are chronic, or sometimes with our AIP cases where they're struggling for oxygen and our heart is pumping really, really hard, we see this rounded appearance or kind of a volleyball shape to the heart where that heart is failing because it's working so hard. There's some recent interest in altitude sickness or in lines of cattle, high mountain disease, again, to try and breed that out of it. But their hearts will kind of look not exactly like this, but they'll be kind of rounded as well. But again, this is evidence of a failing heart and gives us an idea that there's a chance that we've got something else going on in the upstream in the lung that's going to give us these changes here. We always talk about hardware disease. And so here's this shaggy heart. You can kind of see the roughened appearance, and the covering of the heart was really, really thick. And we can see this with Histophilus. I'm an old guy, so I keep using the old bacteria term. Where and it'll be referred to as shaggy heart disease. In this case, here's a piece of electric fence wire that got in the feed. So this piece of wire that wasn't worth anything probably cost us about a $2,000 animal. Naturally, they never die until they're got 150 days of feed under them. But again, when you're wondering about, what could have caused these lesions, there's various things. And I think some of our acute deads oftentimes have some kind of a heart lesion that unless we get in there and look for them, we're really not sure why that animal died. We'll see some odd things too in acute, animals that die in the pen. Here's an abscess in the heart. No idea why it started or what happened. And again, we've got this heart muscle pretty thickened as that heart's trying to work around that. Again, we don't see these commonly, but we certainly can see these, and they really help explain, if you got an abscess in your heart, chances are you're not going to do very well. So at least does help us explain, why these cattle died out in the pen unexpectedly. Liver, again, some things here. This would be downstream from a heart failure. So we've got this round heart that's not working very well, and now we have congestion of blood in the liver. And there's also some toxic compounds that might cause this, but it's not very common in the feed yard. But normally that liver is all one color, and you'll hear this referred to as a nutmeg liver because it kind of looks like nutmeg, I guess. But again, this is just passive congestion where the blood and fluid is building up in the liver because the heart's failing. And again, this gives us an indication as to the puzzle as to how long that calf has been sick, because this just doesn't happen overnight. How long that calf has been sick, how long the heart's been failing, what's going on in the chest. And, we can put all that together to get a better idea as to why the calf died, and also what were we treating that calf for. Bloats, again, you knew I had to get some bloats in here, to help out with my nutritionist friends. Again, you've seen bloats, in your feed yard. And I think the thing to remember is if we leave these deads out long enough in the summertime, they'll all bloat. So just to make sure I can always get a diagnosis, I tell our guys just to leave it out in the sun a little while so I can call it a bloat if I don't find anything else. I always would tell that to Dan Lloyd. I thought it was a lot funnier than what he did. But one of the things we see with bloats is differences in coloration. So as that so here, obviously here's the head, rumen's down here at the bottom left of your screen. So as that bloat occurs and that rumen gets bigger and bigger and bigger, the blood tends to coagulate in the front half of the animal. And so what we wind up with then oftentimes is that when we do these, we lay that calf open, there's his front leg is at the top of the screen. And we get a lot of this fluid and blood and oozing of edema coming out in the front part of the carcass. And if you look at the back part of the carcass, it's really kind of pale because that rumen swelling is pushing that blood forward. So that's oftentimes, again, really helpful in terms of understanding why a calf died. And you know as well as I do that those bloats can occur fairly quickly. You look down at this calf's liver, and I'm not sure how well you can see it, but evidently this calf had been having some issues with rumen acidosis because we've got some liver abscesses actually starting here in this liver. So this wasn't his first go around with rumen acidosis and bloat. And we can tell that by what we're seeing with the liver, and then the bloat comes from that a lot of fluid and redness in the front half of the carcass. Another couple things with bloat, we'll talk about a bloat line. And again, the bloat, this is the esophagus in the right-hand picture. And what we wind up with is the back half is pale, and the front half, like you would expect from the previous slide, is reddened. So again, we have this bloat line here due to differences in just in congestion. So if we see that carcass with a lot of blood in the front half and a lot of this bloat line here as well in the esophagus, and we come over here and look at the rumen wall, and we've got these bald patches. This rumen wall should look like a little bitty green shag carpet. And what we're seeing here is where that green shag carpet has, due to the acidosis, has died and peeled off. And so again, this again helps us put together the picture where we've got this bloating or the redness of the front part of the carcass. We have our bloat line there, and then we go into the rumen and look and see evidence of acidosis as well. That really helps us put together the whole picture in terms of why this calf died. Just a few more. Liver abscesses, again, something we continually deal with. It gives us an indication as to how well we're feeding the cattle from, again, this is typically a secondary issue with rumen acidosis, to where we get these abscesses here. Certainly those of you that are handling beef dairy crosses need to be concerned with that as well. They tend to have a little more, I mean, those cattle are programmed to eat from the Holstein side. And so we can see increased liver abscesses in those that'll really hurt us on performance, as well as liver condemnation. Starting cattle, again, going on down to the GI tract, we always try to look at the terminal rectum and look for coccidiosis. And normally this whole area would be this nice white pale color, and this severe reddening, and we've got some membrane peeling off there, and it's shiny because it's secreting fluid. Anytime we're dealing, you'll see these calves, they'll actually be slow to come on feed. They may have a bloody diarrhea, especially calves in the first 45 days on feed after they arrive. This tends to be kind of our primary GI pathogen, coccidiosis. Salmonella can sometimes look like this, but again, we can take tissues on this and determine, what it is, or your local vet, if they're doing these, can actually take a fecal sample and look for coccidia. So there's multiple ways we can look for that. Again, just another, this was on a calf, this was on a weaned calf. So he'd been weaned about 10 days and was not doing well. They treated him a couple times for what they thought was respiratory disease, and I cracked him open and his lungs were fine, and this is what we found. So again, getting back to using necropsies to better identify how well is our treatment program matching up with our diagnostic program, as to one of the reasons we want to do necropsies. So with that, I see I've probably used up my 30 minutes here. So I'm going to turn it back to Erica or Beth or whomever for questions at this point.